A 16-year-old man comes to the physician with a swollen hand. The patient explains that he had been habitually scratching the area due to pruritus. The patient has a history of eczema. Physical examination shows an erythematous right hand with pustular discharge. Which of the following most closely shares the mechanism which caused this patient's initial pruritus? Choice A, tuberculin test. Choice B, Goodpasture syndrome. Choice C, asthma. Choice D, post-streptococcal glomerulonephritis. Or choice E, granuloma formation. I'll wait 5 seconds and answer the question. So pretty standard hypersensitivity reaction question. And it's just one of those things where you got to remember what goes into what category. This patient probably has cellulitis from scratching, but that's not really what the question is asking. Instead, it asks about the initial itching. There's pruritus, which is eczema, which is atopic dermatitis. And just the fact that it has atopic in the name is actually kind of a giveaway, right? So, of course, that's a type 1 hypersensitivity. The antigen or allergen cross-links IgE, leads to mast cell degranulation and histamine release. And the only one that fits that is choice C, asthma. So just atopy, right? Atopy, asthma, and anaphylaxis. Those are your type 1 hypersensitivities. So now let's look at the wrong answer choices. Choice A, tuberculin test. This is a T-cell mediated reaction, so it's a type 4 hypersensitivity reaction. It's most similar to stuff like contact dermatitis and type 1 DM, where the cells of your pancreas can get destroyed. And of course, if you understand the mechanism here, that type 4 hypersensitivity is T-cell mediated, then you should also understand why in HIV patients, for example, the threshold for a positive tuberculin test is lower because they have a weaker immune system, right? Specifically, that HIV destroys a lot of T cells. It makes sense when you know what you're talking about. Choice B, Goodpasture syndrome. This is type 2 hypersensitivity. Autoantibodies are directed against cell surface antigens, leads to opsonization and complement activation. So some big ones you get tested on, immune hemolytic anemia. You see that a lot in blood transfers. Rheumatic fever, which of course hypersensitivity to strep pyogenes because of the molecular mimicry that it expresses. ITP, immune thrombocytic purpura, where there is antibodies against usually GP2B3A on the platelet surface, so you end up destroying your own platelets. Myasthenia gravis, where you have antibodies against acetylcholine receptors, and Graves' disease, antibodies against TSH receptors in your thyroid, which of course causes your thyroid to go nuts. Makes lots and lots of T3, T4, and you get hyperthyroidism. Choice D, post-streptococcal glomerulonephritis. PSGN is type 3 hypersensitivity, so immune complex formation depositing in tissues. So as far as things on step 1 that you'll see, that is type 3 hypersensitivity. Of course, SLE. A lot of manifestations of SLE is because of immune complex deposition. There's serum sickness, which is often caused by various medications. You have immune complex formation around certain proteins, and it can cause a fever, rash, joint pain. It's kind of non-specific. I don't think they've ever actually tested being able to diagnose serum sickness necessarily, but you do need to know it's type 3 hypersensitivity. And similarly, arthritis reaction, which is usually associated with like immunizations. You'll have immune complex deposition in blood vessels, and you can have very bad inflammation, edema, and in very severe cases, it can have necrosis. Again, it's more important, I think, that you know that it's a type 3 hypersensitivity reaction rather than actually being able to diagnose arthritis reaction necessarily. And finally, we have choice E, granuloma formation. Granulomas are formed by macrophages, lymphocytes, T-cell mediated a lot of times, so it's considered type 4 hypersensitivity. So bring it back. Again, it's a pretty straightforward question. They actually do like asking about this sort of hypersensitivity classification a lot. And they do like making it like third order questions where you need to be able to diagnose it, know what kind of hypersensitivity it is, and then be able to connect it back to some other hypersensitivity reaction. Hope you found this video helpful. I'll see you in the next one.